This conference will now be recorded.
Good afternoon, everybody. Welcome to Allscripts training. Just a reminder, we are recording this presentation, so please make sure that your GoToMeeting is muted. You do that by making sure that your microphone icon is red with a line through it in your GoToMeeting application. Take a minute and double check and make sure that it is muted. We do have a lot of people on the line, so we want to make sure that that there's no background noise. If you have questions during the presentation, we ask that you put that in the group chat. There is an icon that looks like a little speak bubble in GoToMeeting. You're welcome to put any questions that you have there. So you can click on that and send me a message, and then I will get back to that. I will get to those questions, at the end of our presentation. So I am going to launch our Allscripts application here to get to our sign in to the cloud. Click sign in, click our mountain folder and clinical module. From there, it's going to connect to our application, and we will see what we know to be the green screen. And that green screen is going to launch our login information. So we'll log in to our green screen here. And it will pull up the application for us. So we're familiar with this screen, the desktop screen here. Yesterday, we went through our documents, and it was a little repetitive, but it's important for us to understand how we can find our documents through our print module here in our, and when we are have something pulled up for our patients. I'm going to go back to our desktop view here. So it's important that we know that what we can print in our desktop view, and that when we go into our patient view, that those print options change. And then it's important for us to know what those print options are and what we have available to us in our output template options here. We spent a little bit of time in our print packs going over our those print packs and the orders, the same information that we see here. Today, we're going to focus on our surgery order and a surgery order workflow. So I'm going to go to our assessment and plan and remind us that we have a future order pending right here. I'm going to add an additional one. I could go to my short list, then I could go to surgery or procedure, and then I could make a choice from here. Listed from our options listed, or we could search and bring up our procedures, make sure that we have our source correct, choose search, and then we could choose our meniscectomy, move it down here into our current plan. We're going to double click on that. We could put our information here regarding the order. That could be something as simple as we might say that we're going to do 29881, 29877, and 2, 6, there. We're going to choose this for a future date. We're going to, and be thoughtful about that and try to choose something that we think it'll be about 2 weeks, although that we're not locked into that date. We're going to click OK. You'll see it goes from our left over here to our future plans. And so when we sign off on this, and got our diagnosis here. And we're going to sign off on our chart. So here, if we go into our surgery order, our print pack will populate. So we're going to choose OK. We're going to say, what do we want this surgery order for? And we want this for our meniscectomy here. Choose OK. And it's going to take us to our document. To edit it, we could come down here and we could put any of the additional surgery details that we want. We talked about doing an auto replace text option that we could drop something down in here. I have created that under a surgery order template. So if I drop that down in here, I could enter the information either by dragging or by typing. The ones that have choices, I could choose bold and underline for my choice. And I can go all the way through my options here and fill out all of my blanks if I wanted to complete that the way that I would normally do that in the surgery order form. If I click OK, we know that if we go back to the patient's chart, and we go into our attached documents in our patient encounter documents here. If we go to our surgery order, we'll see our surgery order. If we double click on that, it will launch and we'll see our order. And had we filled out the information that was that we could type or drag into this, it would complete that for us. So the other way to do that is that we could go into our print and we could do the same surgery order on demand. We could go up here to make sure our edit is picked. Then we could come down to that same surgery detail. We could drop in our surgery order template and then again go in and enter all of that information. Once we've completed this information, if we choose Save to Log, it will go into the patient's chart. But if we choose this Queue button here, changes our option down to the bottom to Queue. And if we click that, then it will go into a queue for our surgery schedulers. I'll show you how to get to that information. So here on the desktop view, we see we have this option on the left margin called Output Queue. And the output queue we went through this in our setup that we could, we changed some of our filters to see what we could, so that we could minimize our view to maybe our specific location or our specific caregiver, so that we could minimize our options here. So here, the way that we have this output queue created is that we have options, all of the surgeries that we have ordered will be in this queue. So some of our other options are there too, and we could change our categories so that we only see surgery orders. This would be specifically for our surgery schedulers. Under categories, we're going to choose orders, surgery order. Then you'll see that only our surgery orders are populated. We have our status chosen as requiring all action. All requiring action. These are the ones that are pending. These are the ones that, as a surgery scheduler, I need to follow up on and get these scheduled and ordered. If I changed that to all statuses, we would have a list of all the surgeries that have been completed. We can use this view and then sort by our status. Here, if we click on the top column that says status, it will arrange it by by the status of either queued, which means I need to do something, printed, meaning that it's been printed, saved is what we will identify as it being completed. So we can change the view there by clicking on our margin here, and then it will change the view. I'm going to change our statuses to all requiring action, so that I can see only the ones that I need to still work on. Our locations, if you know the location that your provider was in the day before or that week, you could certainly, or if you have one location, you could choose the specific location that the provider was in. Under caregiver, you're going to choose the caregiver. And something that I will admit is a little bit glitchy and will take some getting used to, will be that the caregiver that is listed is that who is creating the order. So even though it's for instance, Dr. Salinger, who is the usual provider for this test patient, if the medical assistant ordered it, then the caregiver is going to be under the medical assistant. Or if the PA ordered it, it would be under the PA's name here listed as caregiver. And so you'll want to communicate with your care teams to say, how are we going to do this and who's it going to be under? And maybe we need to be prepared to look up under the physician, the medical assistant, and the PA if we need to, for best workflows and so that we don't miss anything. It's not ideal. I will call that out. It is not ideal workflow to be able to have to look that up, but we can work around that in good communication within our team. So if we know that that in Dr. Fallinger's clinic, he usually is the one that's going to add that future order for surgery, I can change it to Dr. Fallinger up here in my caregiver. I could set the filter here. We could go to filter, set filter. We're going to change what the actions that I have created right now. I'm going to set that as number 3. I'm going to name this Fallinger surgery and click OK. So then now I have a quick view that I don't have to change all these options next time I come into it. I can go to filter, and then I can come directly into Fallinger surgery, and it's going to pull up these options for me. Then I could work the patients that were assigned to to me through Dr. Fallinger's orders. So I am going to go here to all caregivers, so we get our list back here. I could change the dates. It says here today, but I could choose any of these options. I could say in the past week, in the past month of the surgeries that might still be opened. Sometimes we're scheduling out total joints, 3 months in advance, 6 months in advance, and so we could always choose those options as applicable and what's going to work best for your workflow. I'm going to say that I want to see pending surgeries in the last month and click OK. You'll see that my list got longer because these are all of the surgeries that are still pending for me under all caregivers to be worked. So once I have that view, I could go through and I can see that my patient Brian Test is queued up for surgery. If I double click on his order here, his surgery order will be listed here, and any of the information that it was put into that future order will be available to me to view. I could go into, so it's going to default to our document tab. I could go into our action history tab. I could see any information that was already done, so any actions that were already made for this surgery. And I could add a new comment by clicking this add comment button, and I could say, patient was called and discussed surgery process, date confirmed. We would click OK. And when I make that note, you'll see that an added comment came down here. I could add a new comment. Maybe if I was continuing to work on this patient, I could add a new comment that say pre-op orders sent to PCP office confirmed receipt, and click OK. And then that will add to it too. So we could keep track of where we are in the process of the patient's surgery scheduling. So again, I'm going to show you how I got here. We're here in our output queue. We have our date. I'm going to change that to in the past month. Click OK. You'll see that everything shows our lab orders, our surgeries. If we change our filter to something that we have saved, it would automatically default to that view. We could also change it to requiring to all caregivers for the past month, requiring action, and then we get to that same view. Again, we could save that by going to filter, set filter, do all surgeries. Then we could come here and then we could look at all surgeries by clicking our option. If this is our regular view that we normally want to see, we could go to set user default and I could choose that all surgeries. So now when I go out of this view and I come back to output queue, it's going to automatically default to my view of all caregivers in the past month requiring action for surgery orders. So you can customize our view and minimize our clicks. So if we want to see, here are the patients that are ordered. We have that order that we did today. It's listed here, or yesterday, and it's listed here. We could double click on that order. We could see what the provider has, the information that the provider has given to us. We can go to action history, add comment, and update the process as we go. Click OK. If there's information that we regularly put in here, with this, we might find some benefits to doing some auto replace text in here. So you could do your surgery order. Maybe if the provider doesn't drop in that surgery order template, we could do that here for our workflow if we wanted to complete it that way, or if we got a paper form and we want to make that more digital view, then we could do it through here. Click OK, and then you'll see that that gets updated. Here's some nuances to the process of surgery scheduling and the surgery workflow. That I will again say this is not ideal, and we're looking for enhancements through Allscripts and have offered some solutions to them to hopefully get in place in short order However, this is what we have available to us now. So here we are in the action history. If we print it, fax it, save it to the log, which means it's sending it to the chart. If we do any of those 3 actions, it will take it off of our queue, and it will complete it for us. And so then we wouldn't have the option of looking at it from this view. So it's important that when we are in here, we're using this as a communication tool to add to our comments. We're looking at the document, and it's basically our surgery to-do list. If we see our order and we think, oh, we need to send this to the facility, I'll show you how we're going to do that to ensure that it does not come off of our queue. So we are not completing it from this list until we are done with the surgery scheduling process. When we are done with the surgery scheduling process, we're going to we could double click on it, and then we could save it to the log. Again, using save to the log is putting it into the patient's chart. If we save it to the log, it'll give us an option to put another note in here. We could click OK. And then if I come here, if I close out of here, you'll see if I refresh, that surgery order has fallen off of my to-do list. So what happens if I want to send that order someplace? I need to send it to the patient. I need to send it to the facility, whatever that is. How do I get to that? So if we go into our patient's chart, so we have our test patient pulled up here, toggled over to their screen by choosing the patient toggle. If we go into our encounters, this is our chart view here. I'm going to maximize our chart view. Under our options here, we have surgery order. And then we have the order that I saved today. If I double click on that, my order is listed here. If I chose one that wasn't saved, it was in the queue, you'll see that it has this little these lights here. And if I double click on that, it'll give me that same view, and I could fax it directly from here to the facility. I could print it and give it to the patient, or include it in a surgery packet, or send it off to the primary care if I needed to through print or fax. And it would not pull from my queue if I chose to do it through the chart. So again, I want to emphasize that if we follow this workflow, I'm going to go back to our desktop, go to our output queue. Here are my surgeries, and it's pulling it automatically because I set this as my default view here. So my filter is our surgeries in the last month from all caregivers that are requiring actions that are listed as surgery order here. If I double click on one of these, I could add my notes here. If I print, fax, or save to log, it will remove it from my list. And then our tickler system is gone. But if we want to send this to the facility, then we could go to our patient's chart, look at their chart documents. We're going to maximize that. Go to the surgery orders folder. We'll see that we have 3 queued and 1 saved. We can go to one of our queued surgery orders. You'll see that this is what we populated in our chart today. And then we could fax that to the facility through our faxing module through there. So I know that's a new workflow. It's going to take a little bit to digest and get in and play with it. What I would recommend that we do to start off with, especially for our surgery schedulers, to get in and play with the system and start doing that by coming in and setting our filter cues, our filter preferences, create your defaults, have conversations with your providers to say when our care teams are in clinic, who's going to order the surgeries? Do I need to determine that I need to do one for the MA, one for the PA, and one for the physician? Maybe all three are going to take part of those responsibilities on. Maybe it depends on whether the PA or the physician sees the patient, and depending on who's going to do the order. So we can set those preferences, save them here by going to our filter set, choosing our preferences that will put us in our quick filters up here. If there's something that we want to see on a regular basis, we could go to our set user default, and then we could choose one of these views to be automatic when we pull up the chart. Another way to do it is to change this to all statuses, and then we could use this column sorting by caret up and down to see what has been done and what is queued. So one of the questions that we might get is, what happens if I accidentally fax it from my queue and it falls off of my to-do list? Can I get it back? The answer is yes, you can. We could go to print. We have to go to the patient's chart. We're going to go to print. We're going to go to that surgery order. We will see if it's not signed off on, it would be available here. If it is signed off on, if the encounter is already signed off on, we would go to print. We would choose our output template. We looked at this screen yesterday. We would go to our order surgery, and we would single click on that. Up here in our top bar, our third bar down, it says our encounter, and we would choose the encounter that the order was created under. And then we could double click on the surgery or click OK. It will say, is this the surgery order that you want for that meniscectomy? We're going to say yes. If we scroll down here, we'll see that this is the one that we created today. And then we could choose this queue button, click queue, and then it would go back into our output queue if we needed to do that. So again, that workflow is if it's not signed off on, we're in the patient's chart, we go to print, we go to surgery order, then we could queue it from here if the encounter is not signed off on. If the encounter is signed off on, we would go to print, choose output template. We would choose the appropriate encounter, choose the surgery order, click OK, verify that we want the surgery orders from this order, click OK, and then you'll see it populated here, and then we can go ahead and queue that again to go back into our to-do box. So that concludes our training. It doesn't look like we have any questions, but I'm sure that this will take some to play with and to absorb. So come prepared to go over any questions you have regarding this workflow on Friday at 3 o'clock, and we can answer those questions as they come up. Feel free to reach out to me if you have some questions about your workflow. Work on your memorized phrases. What can you do to leverage these options to either drop in your surgery order template or some regular common phrases that you use in your surgery orders or in those communications that in your queue that you want to use, that you can build those out. So thank you guys for your time, and I'll see you tomorrow at 3 o'clock.